Leptospirosis is a zoonotic disease originating from the contaminated urine of infected animals and widely spread through floods. It is especially prevalent in Southeast Asia and has shown an increase in cases here in the Philippines. The country's poverty, overpopulation, poor infrastructure, and frequent natural disasters from typhoons, floods, and landslides assure the country's status as a third world country. The definition of third world countries are countries classified as poor or developing. These countries are characterized by high rates of poverty, economic and political instability, and elevated mortality rates. The Philippines is plagued with these challenges that hinder progress despite collaborative efforts and aid from nations such as Japan and America towards development and enhanced security. Finding a clear solution to the leptospirosis cases in the country has proven to be a personal struggle that the country cannot seem to get out of. One of the critical health challenges the country faces is the high incidence of leptospirosis. This bacterial infection, often spread through contact with water contaminated by the urine of infected animals, thrives in environments where sanitation is poor and flooding is common. The struggle to find a clear and effective solution to the leptospirosis cases in the country has proven to be an ongoing battle. This struggle is compounded by the country's limited healthcare infrastructure, inadequate access to diagnostic facilities, and the prevalence of other diseases that can complicate the diagnosis and treatment efforts. Efforts to combat leptospirosis in the Philippines include improving public health education, enhancing sanitation, and separating animal reservoirs from human habitats. However, these measures require substantial resources and sustained commitment, which can be challenging to maintain in a country facing widespread poverty and other pressing needs. The fight against leptospirosis is emblematic of the broader challenges faced by third world countries like the Philippines, where a combination of environmental, economic, and social factors creates a complex web of obstacles that are difficult to overcome. Despite these challenges, the resilience and determination of the Filipino people, along with continued international support, provide hopes for progress in the ongoing battle against the disease. Statistically, more than 1 million leptospirosis cases are reported annually, resulting in approximately 59,000 deaths. However, these figures might represent an underestimation or underreporting, largely due to a lack of diagnostic tests in rural areas and the frequent misdiagnosis of leptospirosis as other diseases such as dengue, malaria, typhoid fever, and flu. The male population is more susceptible to infection, mainly because of their outdoor work activities and increased exposure to floods. Effective prevention and control measures for leptospirosis include separating animal reservoirs from human habitations, maintaining cleanliness in human habitations by removing garbage, and vaccinating animals. Additionally, education on proper hygiene practices and the use of protective clothing for those at high risk can significantly reduce the incidence of the disease. Health authorities are also encouraged to improve surveillance systems and provide more resources for accurate diagnosis and treatment to better manage and reduce the spread of leptospirosis. Areas most susceptible to infectious diseases are rural areas since they are far from medical centers and have a less educated population when it comes to infectious diseases. This is why government programs are put in place to keep these populations in check. The second most susceptible are densely populated areas. The Philippines is considered a third world country with a population of 116 million This overpopulation makes it challenging to reduce poverty and affects healthcare, mortality rates, improved sanitation, and family planning. Both of these areas contain vulnerable populations with poor sanitation and infrastructure, which strains the country's economy, creating a cycle where poverty and overpopulation halt any economic progress. Poverty in the Philippines has been the country's worst problem in terms of development. Plans to improve the lives of the poorest of the population have been halted several times by frequent back and forths from the government and rapidly occurring natural disasters such as floods, hurricanes, and earthquakes. Initially concerned with those living in rural areas, the problem has progressed to urban areas, seeing an increase in homelessness. According to the Philippine Statistics Authority, 4.5 million people were estimated to be homeless, with 3 million residing in the capital of Manila. This, combined with the population of rats and stray dogs, makes urban cities like Manila a prime breeding ground for diseases like leptospirosis. From this short documentary, I have concluded that the Philippines struggles to improve due to its high population and rising poverty. In order to make any improvement, the country will need to be cooperative and collaborative with the government and its health officials in heeding their advice. Programs and self-work such as cleanliness, the country needs to be prepared to monitor and be ready for cases of leptospirosis if they want to flatten the curve. The World Health Organization WHO has advised the Philippines to take early and effective steps to minimize the spread of the disease. The most crucial step is prevention. To achieve this, the country has to find a way to achieve proper water sanitization, improve building infrastructure, control the rodent population, and ensure immunization for animals, as well as ensure PPE use for floods. The next step involves rapid testing for leptospirosis cases across the country, especially in remote areas as they are more likely to be exposed and untreated. Farmers are more likely to contract the disease due to constant physical contact with soil, where leptospirosis can persist for weeks. If these efforts are made, we can see a considerable improvement in the leptospirosis situation in the Philippines.